Thank you, Mr. Chairman, and to our Vice Chairman, thank you for a very important hearing. I think as we look to the impacts of COVID-19 on the different sectors, we've certainly had many hearings in the Energy Committee on how this pandemic has impacted different parts of our economy and the people. There is probably nothing more important that we can be doing here in this committee than looking to the impact to our American Indians, Alaska Native and Native Hawaiians. Vulnerable populations, and as the statistics have been shared, very troubling in terms of how we see the health disparities reflected when you have something like a virus, this COVID virus impacting. In Alaska, we have been I won't say lucky, because luck has nothing to do with the fact that we have been able to keep our number of cases very low. What we have done in many of the communities, primarily our Alaska Native remote communities, is they have voluntarily shut themselves off from the rest of the world. They have said, we do not want travelers in here. We do not want the mail plane to come in here. We don't want the plane that's going to be delivering the fresh goods for the grocery store, because we are so concerned about how this virus may repeat history, do a repeat from the 1918 flu, the Spanish flu that wiped out many Alaska Native villages. And natives around the state today remain fearful of just that impact. And so the efforts that have been made to keep the virus out have been considerable. They have been aggressive, and they have been expensive. And so the funding through the CARES Act to help offset this is very, very important. I do think it is also important to recognize that we all want to see these funds dispersed to the villages, to our tribes, and do so in a manner that is consistent with what we outlined in CARES, but also quickly. And it was unfortunate that we saw litigation delay the initial distributions of these funds, and are still delaying some portions of the CARES Act funding. All over a dispute that we felt we had made very, very, very clear when we enacted CARES, that those who would be eligible for this CARES Act funding would be our tribes, and the tribes would include, in Alaska's case, our Alaska Native corporations. And with a recognition of the complexity of the laws and the impacts with how Alaska Natives are addressed and treated under ANCSA and our federal laws. We do not have reservations in Alaska. Our statuses are different when it comes to Alaska Native peoples. And it is an overlay of organizations, tribal health organizations, our tribes, our Native villages, our Native corporations. It is complex. And I think it is important to understand how all of these entities together, working together, are pulling the weight to respond to this impact of COVID. So I didn't intend, Mr. Chairman, to make more than a minute statement, but I felt it was important to outline to colleagues that yes, we all share the same goal here. We want to get this much needed funding out to our tribes across the country. We will do so, but we have to ensure that they are done in a fair way so that those costs that have been associated with this pandemic are reimbursed, and reimbursed fairly and fully. So with that, I'm looking forward to the testimony this afternoon and to direct some questions primarily about where we are with water and wastewater when it comes to Admiral Wiaki. So thank you, Mr. Chairman.